This is Doug Brunk for Global Medical News Network, reporting from the Las Vegas Dermatology Seminar sponsored by the Skin Disease Education Foundation. Dr. Christopher Zachary, who chairs the Department of Dermatology at the University of California, Irvine, presented a talk entitled "Federal Regulations Are Killing Healthcare and Your Practice." Dr. Zachary, one of the recommendations you made in your presentation was to fix the Food and Drug Administration. Could you please explain what needs fixing at the FDA, as well as some thoughts on how to fix it?
Well, I'd be delighted to, Doug. First of all, I want to say that I can't really think of life without some form of FDA. However, let me tell you that whether you are using a medical laser or whether you're using a curling iron, I'm not sure that the two are so very different when it comes to doing appropriate safety and reliability checks. In other words, what I'm saying is the FDA currently is pretty slow and ineffective in speedily assessing safety and efficacy of both drugs and devices. And I would tell you that I think it would be much more efficient and effective if we use the same sort of independent underwriter laboratory type operation that you would have your toaster or indeed your curling iron assessed and authorized by.
Okay. Are there any other take-home messages from your talk that you'd like to share with our viewers?
The cost of healthcare regulation is about $360 billion a year. Now, I'm okay with regulation. For heaven's sake, we're all aware with the deregulation of the banks that we got into a terrible mess. So I'm not saying we should have no regulations. What I am saying is that these should be limited to a reasonable few which can be demonstrated to have a benefit. I will tell you, Doug, that 50% of all healthcare regulations have no benefit whatsoever. So you could save yourself instantly $160 billion annually. Think of amortizing that over 10 years. You'd pay for a new healthcare system. So I think we have to be reasonable here. We have burdened ourselves with a ridiculous amount of legislation, and it drives me nuts. And I'm shocked that we as physicians aren't more upset. We should absolutely take this into our own hands and do something about it.
For Global Medical News Network, this is Doug Brunk.